This is a presentation about how to use AI to enable patient-centric healthcare.
Patient-Human Digital Twin, PHDT platform. This is a neonatal intensive care unit at a local hospital implementing an AI-based solution called the Patient HDT. It helps Dr. Smith, the doctor on duty in the neonatal ICU, to indicate through her tablet the beginning of any critical development, even though all the parameters on the various other monitors are within normal ranges. Her tablet starts vibrating and alarming as she notices that the newborn Leon's HDT indicates worrying changes. She starts to examine the newborn, then scans the risk profile on Leon's HDT and notes the factors identified as critical. Dr. Smith contacts her senior physician at once, who has an authorized access to the patient HDT, and after consultation and taking into account the HDT suggestions, he recommends adapting some treatment measures, which Dr. Smith implements directly. After a successful treatment, she returns to her room to review the details of Leon's HDT on his risk profile and decides that the risk profile should be revised to be more sensitive to certain parameter ranges. She records her recommendations on the HDT platform, which is then shared with her peers for review. A panel of neonatal experts evaluates the different disease risk profiles worldwide and reviews updates and recommendations from various neonatal physicians who use the Patient HDT platform to monitor and treat their patients. The updated treatment risk profile is now accessible to all collaborating hospitals, allowing critical conditions to be predicted more quickly and treatment adjustments to be made at an early stage.
Using AI in healthcare presents several challenges. While there is a wealth of data in healthcare, and medical records and digital data has been available for some time now, it exists in various formats and locations. Without context, AI systems struggle to gain insights from this data. To provide valuable insights, an AI system requires a model that can be trained and utilized. For example, a patient could input their medical condition into the model, which would predict potential outcomes and recommend treatment options. However, building accurate models requires a substantial amount of data, and this data is often fragmented and inconsistent. As a result, the ability to build effective models is limited. Therefore, it is crucial to establish a common vocabulary to access more data and improve the accuracy of artificial intelligence models. What do we mean by a common medical vocabulary? To understand this concept, let's examine a well-known example, the GPT-3 language model. This model uses tokens, sequences of English characters, to represent words. For example, the tokens ham, bur, and jur represent the word hamburger. This vocabulary is the foundation for accessing data and building the model. GPT uses around 50,000 tokens across multiple languages, which it learns from web crawling and analyzing relationships between input and output tokens. Through this process, GPT has learned over 175 billion correlations. Our argument is that to access a substantial amount of health data and build reliable models in healthcare, we need a standard artificial intelligence medical vocabulary. A small vocabulary leads to limited data and an unreliable model, whereas a larger vocabulary allows us to access more data and build a more dependable model. How can we apply this concept to medical conditions? How can we build this vocabulary? These are questions we need to address to improve the use of artificial intelligence in healthcare. The idea is to build a medical vocabulary for specific conditions first, such as COVID-19, by identifying vital symptoms and how they change with interventions. We want to build a vocabulary that encompasses all the relevant conditions related to COVID-19, using a consistent set of tokens. To achieve this, we can use a triplet approach, where we identify 3 parameters, such as the patient's temperature, medication administered, and patient reaction, to create a token. By building a collection of such triplets, we can create a reliable model for the condition. For instance, GPT language model has 50,000 tokens. So, how many tokens would we require to create a vocabulary that captures all the nuances of a complex condition like COVID-19? This is the question we are trying to answer and work towards. Once we have established these tokens, we need to understand their dynamics. The tokens themselves hold little value until we assign two metrics and use algorithms to calculate their significance. The first metric is information value, measured in bits, which corresponds to how often the token occurs in the dataset. The second metric is Bayesian information, also measured in bits, which indicates the token's relevance to a specific outcome. For example, we could assign a value to indicate whether the token has a positive or negative impact on an outcome. Using this vocabulary, we can build a model for multiple conditions that incorporates all these tokens and their respective values. To apply this model in a real-world environment, we have developed a tool called Human Digital Twin, which is an AI-based application that predicts the best treatment options for a patient. The process begins by selecting a patient and tailoring the condition reference model to their specific needs. The Human Digital Twin agent then uses this model to predict a patient's specific risk profile. The medical team will set the treatment objectives, and the Human Digital Twin will start monitoring the patient in real time and use the patient model to make predictions about their condition. These predictions provide the team with valuable information to treat the patient proactively. As the team gains more experience and collects more data, they can update and refine the condition model. In a larger environment, this process would involve many patients and a virtualization platform, the Patient Human Digital Twin platform. Each patient has their own human digital twin that observes and monitors their progress. These digital twins are based on reference condition models, with each patient having a subset of all these models tailored to their specific needs. The Human Digital Twin provides updates to the medical team based on the patient's progress in the form of alerts, predictions, and recommendations. Taking this a step further, we can create a public health reference information model at a larger organizational level, such as a healthcare authority or large hospital. These reference models are used to define and update the condition models, which are then used to tailor patient-specific treatments. The models update in real time, with specialists contributing to them based on specific events or risks. This dynamic process of model creation and patient-specific treatment is crucial to the success of AI in healthcare. By updating the models in real time and tailoring them to the specific needs of each patient, we can provide more personalized predictions and treatment options. What would this implementation look like in practice? We estimate that it would take 2 to 4 years to achieve. The first step is to model the conditions and apply them to patient-specific solutions. This is followed by enabling the HDT reinforcement learning, where the recommendation aspect is refined. As the models mature, they are integrated together, expanding the scope of conditions for each patient. Ultimately, the most advanced level would be to leverage this on a population level. These are rough estimates of the time required for the process. Again, the key to success is starting with the vocabulary, as it enables access to a larger volume of health data. This is the final slide, and to summarize, the first step towards achieving AI-supported healthcare is to define a comprehensive vocabulary in models. We can then create a healthcare platform that links and uses these models to provide predictive and patient-specific care. As patient data is updated in real time, the platform will update the models to reflect the actual condition model's parameters. We already have algorithms in place to build these models and identify their information and Bayesian values. Additionally, we have a reinforcement learning component that provides the recommendation aspect. Our next step is to test these models on larger sets of data. In conclusion, creating an AI-supported healthcare system requires a proactive approach and a comprehensive vocabulary and model definition. With this foundation in place, we can develop a reliable and effective healthcare platform that benefits patients and healthcare providers alike. Thank you.